Nowadays, the problem is not getting pregnant. It's a small aspect. If you force yourself through pregnancies that are just not natural aspect, you always have the repercussions even in your pregnancy. You either get diabetes, you either get hypertension, you land into preterm deliveries, you also have a high risk pregnancy that needs constant monitoring, a stressful pregnancy, and post delivery also the babies are landing into similar kind of complications.
Okay.
Because if you have diabetes during pregnancy which is controlled or uncontrolled, even after delivery that is going to be carried forward by the baby. You have a genetic inheritance of diabetes in the baby, and a newborn with an impact of high sugars inside the mother will not be able to survive that easily in the natural environment. Maybe 1 in 100 child can even have lot of complication in terms of succumbing to the natural complications of low sugars or high bilirubin or something or the other.
Okay.
So this aspect parents have to understand to cut down on complications in the next generation. To have a healthy child, to have a healthy pregnancy, a priority should be given to a healthy planning of pregnancy.
Okay.
Because I'm telling you, I had a couple last week who in fact were diabetic
Okay.
since 13 years, and she was on high sugar medications, she was on insulin. Everything seemed right during pregnancy, everything seemed good during pregnancy, but insulin and high sugars will have an impact on the baby, right? She just came and we delivered, but post delivery the complication started, not for the mother, for the baby.
Okay.
Baby's heart contractility was not good. It is one rare phenomena that is because of uncontrolled sugars or chronic diabetes. Even if the sugars are controlled, chronic diabetes in the mother. So that comes with egg quality. That can also come with sperm quality at times. But this baby had cardiac contractility issue. If the heart is not contracting, definitely the baby is not going to make it. After 2 days, the baby succumbed. But what is the reason? Still is a huge question. Whether she has to go for another pregnancy or not, it's a huge question. So it is not as simple as it looks.
Okay.
And people are too casual about their own self. They compare. My friend is diabetic from so many years. She had a delivery in fact, and the baby was all fine. But that doesn't happen always. And everybody has a different picture to say. Everybody has a different story that speaks.
Correct.
And you cannot say that you will have no issue in the future.
Correct.
Because tomorrow, after a year or 2 years or 3 years, if the baby starts developing diabetic symptoms, who is blamed for?
Right.
So, genetic origin of all adult related diseases is in the mother, is epigenetics, the quality of egg and quality of sperm.
Okay.
So it is not as simple as you take it. And for anybody who's actually, very comfortable in their zone, chilling, eating, enjoying, it is difficult for them to suddenly change their perspective and come. They always relate, even in my OPD, they always relate that my friends are the same, they've had children. But are you going to wait for 10 years for that child to show something else?
Right. It's better to be careful from
Obviously, you have to be careful. There are hundreds of people who don't wear helmet and drive. But if one of them gets hit and dies,
Yeah.
that's why
can't
all
take the
100
chance.
should be wearing a helmet.
Correct.
This is a simple concept which foolish people will never understand. And this is the same concept that I am talking about. You have to improve your egg and sperm quality for a healthy progeny in the future.
Okay. It's not just a healthy pregnancy, it's a
Yes.
healthy egg and sperm for
Yes.
to have a healthy baby.
Yes, healthy egg, healthy sperm, healthy lifestyle, healthy mindset. People with difficult mindsets do not gel with each other, and the constant differences actually lead to fertility issues. Because even the body understands with such amount of clashes in between them, is a baby going to be safe? So there's a superpower sitting in our own self, our brain, our hormone system, our actual intellectual aspect that defines who has to get pregnant, who doesn't have to get pregnant.
So until everything is right,
Yes,
pregnancy
you
will be
have
difficult.
to be answerable to that super mindset that yes, I am ready and my body is okay and I'm set for responsibilities. Only then it releases the acceptability of pregnancy.